For those who received a chocolate bar, you really didn't do anything to deserve it. And you didn't earn that advantage. For those that didn't get a chocolate bar, you had no control over your disadvantage. And I think we'll agree that's the same as barriers we have in society when it comes to health inequalities. Okay, let's look at it a different way. Raise your hand if you live within 10 minutes of a GP surgery, and that can be to walk, to drive, to get the bus. Most of you, most of you. Anyone not put their hand up? You don't live within, no? Do you live in a rural area? You do. Frustrating? You drive, okay. Yeah, absolutely. Yeah, some areas, let's not forget, do not have really good bus routes. And I think it's a particular problem if you live in a rural or coastal area, and some of your neighbourhoods will have rurality, but they'd also have urban. And you'd think urban, good public transport, but not necessarily. So, for instance, I live in Basingstoke. Everything leads to town, doesn't it? Everything leads to the railway station. But if you live on one estate north and another estate south, you have to go into the bus station, out to the bus station, into the bus station, out. So it could be 4 journeys to get to your nearest GP surgery if it is on an estate. So I think it's worth, we know about our populations, and we may know from data some of the health inequalities, but it's really important that you get to know what the public transport links are, not just in terms of where the bus routes are, but how much they cost, and bearing in mind if someone's got children as well, and that cost keeps going up. So put up your hand if, what was the next one? You can easily take time off for medical appointments. Okay, most people, that's really good. And there'll be some people in the room, which I won't pick on, I won't ask, but there'll be some people in the places that you work in that can't afford to take time off work, because if they take time off work, they don't get paid. Now, I'm very privileged. If I've got a medical appointment, I just put private appointment in my calendar. Not everyone has got that advantage. Okay, put up your hand if you worry about being able to afford public transport. No one. You do? Do you want to share? Is it expensive? Yeah. Yes. True. Yeah. Absolutely. Yeah. Public health. So public transport can be very difficult. And the weather conditions, and if you are going to get a taxi, it's going to be out of some people's price range. Okay. So, where am I looking? Up there. So if we go to the next slide. Thank you. Just about read that. Okay, so I think we've discovered health inequalities are avoidable, unfair, and systemic within the different groups of people we live. So a couple of examples, depending what neighbourhood or place you live, you could live 10 years longer. For instance, someone in a more affluent area could live 10 years longer than the person that lives in a more deprived area. And if you think about that, 10 years, 10 years is a long time. If you think about your last 10 years, that's a big length of time. Also, in terms of smoking, diabetes, and mental health, in areas of deprivation, you could have higher rates. And that's not just an assumption. We know that from data, and we know that from GP prevalence registers. So that's just a couple of examples. So next slide, please. Is anyone familiar with Core 20+5? All good. A few hands, a few hands. So Core 20+5 is NHS England's approach to health inequalities. And the Core 20 bit relates to the 20 most deprived neighbourhoods in the country, or LSOAs, so areas of deprivation. So that's across the country, and then it's sort of dissected. If you're from decile 1 or 2, you'll be in the deprived neighbourhood. They've then prioritised some clinical domains, one being maternity, and that's about continuity of care for Black, Asian and ethnicity groups. We then have severe mental illness, and that is about increasing health checks for people with mental health problems. We then have respiratory, and the main driver of the respiratory objective in this approach is to increase flu vaccinations and COVID vaccinations. We then have cancer, and this is very much about diagnosing earlier, especially in inequalities groups. So diagnosing at stage 1 and 2, as opposed to 3 and 4. As healthcare professionals or social prescribers, it's also a good thing to have in your armoury, just to know what the basics are around screening and eligibility for the people you may work with. And the last one is hypertension there, and that is very much about detection through blood pressure monitoring and management of hypertension. And then down the side there is what we call the plus groups, and these are groups that are selected by the Integrated Care Partnership that we should have a focus on. Homelessness, I really am struggling to read that. Let me look at it this way. Oh, refugees, asylum seekers, ethnic minority groups, people with serious illness and learning disabilities. So those people we should really be focusing on, especially around those clinical domains. Okay, next slide. So we've discussed some of the factors, and these are some of the common ones that contribute to health inequalities. Social economic, so that will be your income, it could be housing, educational, relates to poverty. Then you've got geographic, and we've discussed that. So that's where you live, whether it be urban, rural, or coastal. Or it could be that you're from a specific group, and we call these inclusion groups. And the people that are from inclusion groups, for instance, are vulnerable migrants, need to look up here, gypsy Roman travellers, people experience homelessness, offenders, and sex workers. There's a couple missed off that list. Anyone want to guess? No? Okay, let's go to the next slide. I probably wouldn't have guessed this one. I think more obviously substance misuse, that is one of the inclusion groups that listed under NHS England, but also victims of modern slavery. So if we move on to the next slide. Protected characteristics. You'll be familiar with this if you ever complete an equality impact assessment. And these are all the characteristics you need to check to make sure that your service is fair. And as you can see there is some overlap with the inclusion groups. So, if we move on to the next slide. So, So, we're going to have a quick quiz. What was that theme tune to? That's it, quiz over. No, we really are going to have a quick quiz. So, in the style of Who Wants to Be a Millionaire, it is amazing what ChatGPT can do when you ask it. Okay, so a male's life expectancy in parts of Winchester is 8 years longer than that expected in parts of Havant. Is that socio-economic? Is it? If it is, right arm? Because I've got no mentee, sorry. We're going to have to do it old school. If it's geographic, left arm, B. If it's an inclusion group, C. And if it's a protected characteristic, stay seated. The answer is geographic. I think most people got that right or didn't know their left and right. So, moving on to the next question. A carer working a 0 hours contract can't afford to take unpaid time off work for their health care appointment. So is it A, right hand, B, left hand, C, stand up, D, sit down? Very good, very good. Q slide, was that correct? No. So, was that? Did everyone get that right? That was left hand, most people had up. Well done, good. Yeah, okay. The next one is gypsy and travelling communities are less likely to register with a GP and often use A&E in emergencies. A, B, C or D? Yay! Good. Well done. Okay. For the last question. Yep, okay. A hospital only sends appointment letters in English. Patients with limited English miss appointments. So which barrier is that? Well, so, you're all sat down. I'm thinking, why aren't they moving? Right, can you hear me? Actually, you're sort of right. If you go to the next slide, it's both. They are an inclusion group and they are protected characteristics. So if you move to the next slide, it shows you how this can happen. It's where those health inequalities can overlap. And you could have people in one of those circles, 2, 3 or 4. So thinking about that, especially in terms of neighbourhoods, I think you're social prescribers, you're going to think about the individuals, but when you're developing neighbourhoods, think about those groups for your population as well. Now, the next one, I'm not sure, so how long have we got, Tim? Is it? So we can do the quick group exercise. Not sure how it's going to work with noise, but we'll see. Okay, so I'm going to get you into pairs, or the person sat next to you, and if you do find yourself in a 3, that's fine. A young mum on universal credit can't afford healthy food during pregnancy and struggles to pay the bus fares to attend prenatal appointments. And these are the 2 questions I want you to consider. How might these barriers affect the health outcomes of both mother and baby? And what practical steps could local services take to reduce these inequalities? So if I give you 10 minutes, is that 5 minutes? I'll give you 5 minutes, just sit to the person, then we'll do some random feedback. Okay, let's start with the first question. What health outcomes could this affect for mother and baby? Stick your hand up if you want to talk, and Tim has got a microphone. Here we go, down the front.
I work in, I work in some rural areas, rural villages. So with the young ones, we would use the community transport to get them to their GP stroke NHS appointments. So that would cure that area. We would signpost to home groups. Home groups would pick them up. They'd also look at all their finances and everything else. I would do a home visit to see if the home is suitable, maintained, see if everything was all okay. And then that would just could escalate onto whether that's, could be safeguarding, it could be extra support, bringing in social workers. We'd look at the finances to see if everything's okay there. We've got other charities that support, I've forgotten the proper term, but it's mums with babies up to a year old. They come into groups, so we also, support the mental health side, because I'm in the mental health team as well. So all areas would be covered. There are charities out there to support them and to get them to their appointments.
Yeah, it's very complex and something you might come across if you were working with that age group. I'm just going to ask Katie, we have a doctor in the room, what health outcomes in terms of physical health, if you couldn't afford to get to appointments or eat properly, what effects could that have on mother and unborn child?
The whole idea of the antenatal appointments are to pick up any pregnancy problems either for the mother or the baby. So at the worst case scenario would be they don't survive even. That's really extreme, but actually having a sort of, a small baby that's premature or something like that would be more likely if you couldn't sort of attend your antenatal care. And the sort of, the poor diet could also contribute to any, poor medical outcomes. So am I allowed to start answering the second question as well?
Yes,
okay.
Please do.
Shut me up if I go on too long. I would refer them to our social prescribers because they would be ideally placed to plug them into sort of the local organisations that could potentially help with the transport, explore sort of whether there's any other options. So like, some GP surgeries have more than one branch, and it might be that actually having that appointment at one that's closer might suit, or just a different time of day when somebody was able to give them a lift. It can be really simple things that actually make a big difference if you just think about it and ask the right questions.
Thank you, Katie. So it's just, hearing that from a medical professional. So these inequalities, which are basically social determinants of work, can actually have that physical effect on patients. So this is why it's so important that we have social prescribers and other workers that help with that more holistic care. So I'm just thinking, must have some examples in the room of what services there might be out there for people in this situation. Over here. Oh, you're making Tim run. He'll get to,
You're just doing this deliberately.
He'll get to you, but it might be
just doing it deliberately.
10 past 12.
Keep me fit.
Oh no, we'll come to you in a minute.
Oh.
Yeah. Okay.
Am I okay?
Yep.
Thank you. I'm from Library Services, and we have so much, certainly for new parents, and we've got learning in libraries here as well. So there's courses which are mostly free, including paediatric first aid, mental health first aid as well, new parent meet and connect groups which are all free in warm welcome spaces such as libraries. You don't have to be educated or borrow books at the end of it. Obviously we'd like that, but it is certainly a free social group for people, a good, perfect example of a young mum. Rhyme times, story times, what else? Local communities. Yeah, and signposting as well. We do lots of health visitor checks within libraries, social prescribers visit libraries, all sorts, isn't there? Yeah, thank you.
Brilliant, thank you. Yes, do remember your libraries. And just a little bit of a shout out, there is going to be NHS app surgeries coming to a library near you. So we'll promote that in good time. There was a lady here.
Bring back the Sure Start centres, right? Is all I've got to say. I remember my red book. Yes, so I'm from No Limits in Southampton, which is a children and young people's charity from 5 to 25-year-olds. I would signpost this young person to come to our Bright Beginnings group, which is for young mums. They can simply walk into our advice centre, or a worker will come out to them and they can meet other young mums. They can talk about development, they can talk about all sorts of things. As a YAC, so the Youth Information Advice and Counselling Centre, they can also talk about finances. They can talk about what matters to them, and somebody can help them map out how to make their universal credit go further, how to get there, and also to kind of stop the barrier of social isolation, which may happen if this young mum couldn't get out and couldn't afford to.
Brilliant, thank you ever so much. There's a hand right at the back over there.
And just to add to the comment about reinventing the Sure Start, of course, what we do have is Best Start
Right.
family centres, slightly different name, same thing, different. So there are new centres now being created, and Hampshire County Council Children's Services are leading on this, and again we can connect you up with the relevant districts. If you're not involved and you work in Hampshire as opposed to Portsmouth, Southampton areas, do connect up with your local children's partnerships if anybody's particularly interested in finding out more about Best Start centres. And if you want some contacts for local children's partnerships, my lovely colleague Jane has got a hand up, and Jane is our coordinator for those partnerships, so that brings organisations together, and we get regular updates on where the Best Start centres are being hosted and where they're going to be located and how they can start to bring some of those services together again. So it is a good opportunity.
Hello, so I'm from Barnardo's, but we run Hampshire Healthy Families and Hampshire Healthy Step schemes, but there's also the Healthy Start vouchers for families, which they can get healthy food and vitamins to support during pregnancy and when they are under a certain age. If you want a little bit more training on what it is, we've just started some new training around Healthy Start. So it's a half-an-hour professionals training that you can come and check how families can apply, whether they qualify as well, and universal credit is one of the qualifying factors, so they can use those to support them in that journey as well. But our Hampshire Healthy Families programmes, which do often run out of libraries, we work alongside the health visitors and the school nurses and the nursery nurses, but they're the community offer, so they can come to a 5 to 5 programme, for example, and then Healthy Steps is from 2 upwards, all around healthy eating, budgeting, and what else is on offer for families and how we can support them, like behaviour change, like social prescribers as well.
Thank you ever so much. I'm just looking around the room to see if we've got any stalls as well that might be relevant. Give a shout out. Wait, this is the last one, actually.
Well, there you go. Well, if you're looking for stalls, also, it's always worth pondering. Before I start, I work for the Citizens Advice. Sorry, just so you know in what context I'm talking. I put out a shout. I have 3 kids. This is relevant. My youngest is at university, and before I sort of went, so that potentially, we're talking young mums at university. It happens. But most young kids don't know that Citizens Advice are a free agency that they can go and see. So, we're trying to do all we can around, we're very lucky we have a lot of student volunteers at Citizens Advice that help us to sort of raise awareness. There's a lot of, if they don't know it exists, we can tell them, but also, it's worth, it's a free service, it's a registered charity, it's not a government agency that they need to be scared of, and I think sometimes that's the thing. But we could help them, come and see an advisor for free. We can help them with their universal credit claims, any other benefits that we might be able to put them into context with. You know, maybe we could put them in contact with food banks. Maybe there's a million different things that as Citizens Advice we can help with. So our major thing in that is just making sure that people know that they can come in and there's help and advice and it's free. Brilliant. There you go.
Thank you ever so much. Yeah, and there's various ways to access Citizens Advice. You can walk in, you can go online, you can telephone. And you know, that they can help with most things, and if they can't, they'll certainly try to signpost you. Okay, so I think what's happening next is there's going to be a Q&A panel up here for about 12:15. So we'll be shifting some deck chairs, I believe, but people can stay in here. Is that right, Tim, while we're waiting?
Yeah. We've got till 15:15. Yes. If anybody else wants to make any comments or
wants to give a shout out of support services.
That's all right.
I don't know, I need that. Hello, can I just ask you, so I won't say what area, because obviously you know I work for Hampshire, I won't say what area, but I wanted one of the patients I was supported to be supported by Citizens Advice. This patient didn't have access to public fundings and was refused support from Citizens Advice because he didn't have access to public funding. Is that correct in your area that you work in? I was quite shocked, if I was honest.
I'm not sure I understand the context of the question.
Right,
so if I can sit with you.
So obviously we work with all different areas, some of the minority groups, the complex groups, about people that come into the country, they might have been here for years, or they're over here on contract work, but they don't have any right to public funding. So
you're talking about benefits specifically, like universal credit?
No. Well, that as well.
Okay.
But so I had a patient, I won't say it was male or female, I had a patient that needed some advice, was working, but he needed some advice. So I did the referral to Citizens Advice and said, we can't support him, I've said it now, because he doesn't have access to public funding.
I can't say that that's something I've heard of.
Okay, so that's good.
I've got some lovely colleagues that are trained advisors.
Okay.
Yeah. Do you want to come over too?
It's okay.
What we could do is over lunch, if you want to connect and maybe pick it through or put you in contact with someone.
So that's really good to hear. So I would go back to that department and say...
Obviously, you know who I'm within Citizens Advice. So
of course I do, because I know who you are.
That sounds dreadful. I don't say sometimes. Refer them, give them to me, and just give them my details.
But that person's been deported now, so sadly. I just wanted to reiterate that. So I will pass that on to my colleague who's in another room.
I mean, we can recognise Basingstoke, Havant, East Hants. I know that we've got an advisor from Fareham in too. Not our experience. We don't turn anyone away.
Okay. So the next time one of the members of staff, I will. Yeah. Thank you. Okay. Thanks very much.
Okay. Excellent.
I think there was a hand up at the back. Just Jess, if you've got a couple of minutes.
We'll take one more hand at the back, and then we will start for the next session.
Hiya, I just wanted to say that I have referred clients into CAB with no recourse to public funds, and they have been supported fully.
Brilliant. Okay, excellent.
And I'm based in Winchester.
Yeah. Thank you for that. So, you can stay where you are, or you can have a very quick comfort break. We will be reconvening in here at 12:15.